Hello, my name is Dr. Joe Childs. I'm a board-certified functional neurologist, and today I want to talk to you about vertigo, dizziness, disequilibrium, Meniere syndrome, poor balance. I want to talk to you about a natural solution to these problems. So if you suffer from vertigo or dizziness or any of those conditions I just talked about or just mentioned, I think this video is going to be very eye-opening to you. Do you suffer from vertigo, dizziness, or poor balance, or fear of falling? Have you been to your primary doctor? Have you been to your ENT? Have you been to multiple ENTs? Have you been to neurologists? Have you had blood work to determine why you have the vertigo? Have you had a brain MRI that came back negative? You went to your ENT, they can't find out why you have the problem. They say they give you antihistamines, they give you a drug called meclizine. They can't really figure it out. You had the brain MRI, everything comes back normal. They say they can't find anything wrong with your brain, nothing wrong with your blood work. You had special testing where they put these goggles, they pumped air into your ears, and they can't find anything wrong. Does this sound like you? The majority of people that come into my practice have these types of things. They've been to all these different doctors, have been everywhere, they suffer from vertigo, they suffer from dizziness, it's ruining their life, but nobody really has an answer. They just keep getting medications. They get antidepressants, they get meclizine or Antivert, they get antihistamines, they get all these different things, Valium, and it's really not helping. If that sounds like you, stay tuned. I want you to learn a little bit about vertigo. So what I'd like to do today is talk about what causes vertigo, what causes dizziness. There's a lot of causes for these types of things. There's really two main possible reasons for your vertigo and poor balance if we were going to put them in two general categories. You can have an ablative problem or a hard problem. This is the thing that you see on imaging. These are things when you go to the doctors, they send you out for MRI, send you out for CAT scans. This is the unfortunate people. These are people that have a tumor. They say they had a stroke. They have had some type of brain bleed. They have something you can see on MRI, okay? MS would be one. That's called an ablative lesion. The majority of people that go and have the MRI for the vertigo and dizziness, they don't have an ablative lesion. They don't have a hard lesion. They have a functional problem, a physiological problem. You can't see this on imaging, meaning something is not working well in their brain. The physiology is not functioning properly. However, there's nothing you can see on MRI. So the question that always comes up of these physiological problems, is it a peripheral problem or is it a central problem or is it a combination of both? So let me explain. Peripheral means on the outside. Peripheral means it's coming from your inner ear. It could be coming from some of the canals in your inner ear. Or central means that it's being caused by some malfunction in the way your brain is functioning that, again, you can't see on MRI. So let's talk a little bit about peripheral. When we look at your ear, okay, you have, obviously you have your external ear, the external ear canal, and then you have your inner ear. In your inner ear, you have one section of your ear called the cochlea, that's for hearing. The other section of your ear has the vestibular section, or the balance section, or the section when it malfunctions you get vertigo. So you have these three canals on both sides of your ear, and what these canals do is tell you where you are in space. If you tip your head back like this, a canal fires and it tells you that you tipped your head back. If you tip your head like this, tip your head like this, that's what tells you where you are in space. And these canals come into your brainstem and they go up and they actually cause your eyes to do different things. So if I tip my head back, my eyes go down. If I tip my head forward, my eyes go up, and that's because there's fluid in these canals that send messages into your brainstem. Okay? So peripheral problems are when there is a problem with one of these canals, and there could be multiple reasons. It could be inflammation. It could be that you have a crystal in one of these canals. So a lot of times you go to see your doctor and they'll say, I think you have a crystal in your inner ear, or what's called benign paroxysmal positional vertigo. And so that's called BPPV, or it's called positional vertigo. These crystals are not like kidney stones where they form and they're abnormal. These crystals are normal parts of your anatomy that they're in what's called an otolithic organ. An otolithic organ is actually filled with crystals. And those crystals have to stay stuck on that organ because as fluid goes through them, it tells you when your head is moving in a linear fashion. So sometimes those crystals will break off and they will get into any one of these three canals. So the way you test for these, what we do is it's important that you test with vision testing. We put these things called V&G goggles on, and we measure which direction your eyes are moving when we put your head in a certain position. If you have these crystals, you can have severe dizziness from these things. So that's, again, peripheral is BPPV. That's your most common reason. Now you have three different canals. So sometimes you can go to your doctor and they can do the traditional Epley's maneuver, and it may be the wrong Epley's maneuver for the specific canal that it's in. The most common canal for you to get a crystal in is called the posterior canal. And that's why usually you get dizzy when you lie on your back or hang your head off the bed or something of that nature, or get up too fast. Well, we have to determine, because each canal, when it's not functioning well, will create a certain position of eye movements that are abnormal. Okay, and then you also have the anterior canal and you have the horizontal canal. So you may have a problem with crystals in multiple canals in either ear, and you may be getting Epley's for only the posterior canal, and that's why you're not getting better. In our office, we can figure out exactly what canal the BPPV is in, or the crystal is in. The second thing is Meniere's disease. A lot of people become diagnosed with Meniere's disease. Usually you get hearing loss, you get ringing in the ear, or what is known as tinnitus. You also get fullness in your ear, and you get vertigo episodes. With benign paroxysmal positional vertigo, you get that it's positional, so you will lie on your back or lie or bend over, and you get really dizzy for about 30 seconds to a minute, and it's severe. It may even make you nauseated to a point of vomiting. Meniere's disease is you're going to get vertigo episodes that last anywhere from 5, 6, 7 hours all the way to a week long. And what Meniere's disease is Meniere's disease is a swelling of that inner ear, secondary to an autoimmune problem, meaning your own immune system is attacking your inner ear. Okay, so we need to treat these patients with nutritional care and vestibular rehabilitative care, because what happens is with Meniere syndrome, most of the times when you get Meniere syndrome, or your doctor tells you you have Meniere syndrome, they're going to tell you, oh, you know what, just take this antihistamine, or take this steroid, or you know what you need to do is stop eating salt. Well, stopping eating salt will reduce the amount of fluid that you have in your body. That may help a little bit, but it's not addressing the true cause. The true cause is your own immune system is attacking your inner ear. So we need to find out what foods you're sensitive to. We need to find out if you have a healthy digestive tract, because people get what's called a leaky gut or intestinal permeability. You can Google that. A leaky gut will create inflammation in the gut, creates inflammation in the body, and creates your immune system to react. Medically, what they do is, with Meniere's, if it gets to a point where it just doesn't ever go away, is what they'll do is they'll kill both sides of your inner ear with a drug called gentamicin, or they'll do it surgically. The problem with that is if you age, let's say you're 50 when your Meniere's kicks in, by the time you're 70, you're going to have severe balance if you have no inner ear function. Your inner ear controls and helps steady your balance. The other possibility is something called neuronitis, and neuronitis means you have an infection. Usually it's from a cold or viral infection that infects the nerve that's coming from one ear or one inner ear to the brain. And what that does is it makes one side go down, and it creates an imbalance. So your vestibular systems need to function equally from side to side. If they're functioning equally and the messages fire into the brain, and the brain that takes the messages from the inner ear is functioning equally, then you're going to be really balanced. But if one side goes down, the other side's going to be strong, and it's going to create a spinning feeling. It's kind of like if I was riding my bike. If I ride my bike and I keep both my arms stiff, I'm going to go in a straight line. But if I totally relax one arm, keep one arm stiff, I'm going to circulate or roll or go into a circle. And that's what happens when you get this neuronitis. Usually you're going to have an infection that causes this. Now the problem with the neuronitis is it actually can damage that inner ear for the long haul. And if it damages that inner ear for the long haul, you may have what's called a old or chronic neuronitis, vestibular neuronitis, which basically means that this side is actually, you have less vestibular function. So we need to do some things to improve the inner ear on that side. So we see all three of these types of peripheral problems. The other problem is central problem, a functional central problem. So what do I mean by a functional central problem? Well, the messages from your inner ear fire into your brain stem. And from the brain stem, the messages fire up to your eyes and move your eyes in relationship to your head. Excuse me. And the other thing that it does is the messages go down to your neck from the brain stem and control your neck muscles. When that's all distorted, you can have things like dizziness and vertigo and things of that nature. So centrally, you may have a problem with the brainstem, and then there's another area called the cerebellum, which is the back part of the brain, which controls integrating all of this vestibular information. So some people, due to age, due to poor diet, due to head injuries, due to multiple things, can start to have central functional problems. Again, you cannot see a functional problem on MRI, so if you go to your neurologist or you go to your ENT or you get an MRI, they're going to say there's absolutely nothing wrong with you when there is a functional problem. Functional problems, treated medically, they treat them with medications, but the medications really can't fix a central problem. It takes vestibular and functional neurological rehab to make these things better. So central problems, they can be caused by age-related. They can be from long-standing peripheral problems. People that have long-standing Meniere's disease, long-standing benign paroxysmal positional vertigo, or long-standing neuronitis problems or inner ear infections can eventually create problems with how the brain functions. Metabolic or nutritional, people that have high levels of inflammation. Inflammation in the gut eventually affects your brain. And if you're constantly inflamed, eventually your diet will cause you, or your brain will start to not function as well. People that have diabetes will have decreased brain function over time. Previous ablative injuries, so people that have had MS, people that have had a stroke, people that have had these different things can have altered function in their brain that can be addressed through functional neurology. Head injuries can cause it, and then also people that have neuropathy in their feet and in their hands and things like that, that really will affect the way their central nervous system functions over time. So a peripheral problem, a problem in the inner ear, a problem in your peripheral nervous system will eventually create central dysfunction. So people that have all this BPPV will eventually have central or brain dysfunction. And then that can really create that hard to address, that hard to fix vertigo. The people that come in and see us with vertigo and dizziness and balance disorders, the people we see are the people who have been everywhere, the people that have failed everywhere. So we take care of that percentage of people that can't get well anywhere else. And then we fix 90% of those people. Click on this Facebook post and you'll go to our website and you can see multiple testimonials of people we've helped with vertigo, dizziness, Meniere syndrome. And the common theme is they have been everywhere and tried everything before they came here and got better. So again, your eyes, your inner ear, your brain, and your neck must all work together. The messages must come in. Vertigo is a sensory mismatch, meaning if the information coming from your neck up to your brain is not equal to the information coming from your inner ear up to your brain, then you're going to feel this altered sense of reality. You may feel like you're spinning. You may feel like when you walk, you get pushed to one side all the time. You may feel that you get lightheaded when you get up too fast, or you may feel multiple types of things, or your balance may be bad. Again, falls are the #1 cause of death in people over age 65. Don't just believe me. Go ahead and Google that. That's the #1 cause of death. So you want your inner ear and you want your brain to function as good as possible. So we use advanced diagnostics. So we're going to look at eye movements. We're going to determine exactly what's causing your problem based on these eye movements, and then we create a tailored approach to helping you for your specific problem. Every single person that comes in here is a little bit different in where the problem is and how it needs to be addressed. What canal is it in? How is their brain being affected? So we find the underlying cause. That's the difference. Then we address you neurologically, metabolically, and structurally. So you could have a problem with your neck. It's called cervicogenic vertigo. It's vertigo that comes from a problem in your neck. We're going to look for that. Metabolic, you may have long-standing food sensitivities and inflammation and high blood sugars and things of that nature. And neurologic, we're going to find out how that brain is functioning, how that inner ear is functioning, those types of things. It's usually a combination of all three, especially the people that can't get help anywhere else. Usually they need all three of those types of care. So what we do from that is we develop your specific drug-free treatment program specific to you. So it's really good. We have such great success with people with vertigo and dizziness. So if you're suffering with these, you have a loved one that's suffering from this, I would highly recommend that you call our office. So again, our office, Corrective Chiropractic Neurology and Functional Medicine Center, right down in Downingtown past Wegmans. Click on this post here and you can go to our full website. It's called Chester County Balance and Vertigo.com, and there's an offer for you to come into our office and have your vertigo and dizziness checked by us. So thanks for listening. Take care.